Aortic dissection often leads to a medical malpractice case because it is not diagnosed before the patient dies. And what an aortic dissection is a tear in the aorta. The aorta is the very large artery, the largest artery in the body, which carries the blood out of the heart that has been oxygenated by the lungs. It's now being carried out of the heart and being pumped throughout the body. So you can imagine the terrific force exerted on the aorta by the heart when it's pumping the blood throughout the entire body. As a result of this intense pressure, it is very, very common for people to develop a small tear in the aorta, and it usually occurs just as the aorta is leaving the heart. It can also occur once the aorta comes up out of the heart and comes around and goes down into the abdomen, which is called the abdominal aorta. But most commonly, an aortic dissection occurs in what's called the thoracic aorta, which is the aorta in the chest. And this is something that must be immediately diagnosed and treated. If it is not immediately diagnosed and treated, that tear will get bigger and bigger and bigger, and eventually will lead to a blockage of the aorta or a through and through perforation of the aorta, which will lead to almost sudden death. It's an acute emergency. It must be diagnosed and treated immediately. What we see is oftentimes people will go to the emergency room, they will get an X-ray, which is not an exam that will pick up an aortic dissection in most circumstances. So a CT scan must be done. It will easily pick up an aortic dissection. The surgical team will come in. But if that is not done, what we see often is chest X-ray is done, it doesn't show a dissection, and the patient is sent home. And often the patient will then suffer a worse dissection and die at home. Or they'll be kept in the emergency room, maybe admitted to the hospital, but a CT scan is never done, and the patient will then suffer a tragic aortic dissection. So if this has happened to somebody in your family, you should call a lawyer immediately, get the medical records and all of the imaging studies which were done, and have a lawyer, and a lawyer will then get a radiologist and other medical experts to review the situation and find out whether there was a failure to diagnose an aortic dissection.